Say that oral health care and dentistry is an important part of your overall wellness.
Yet the American Dental Association estimates that 2/3 of all dentists in the U.S. do not accept patients on Medicaid. That has a big impact in areas like Kentucky's Appalachian counties, where there's a higher number of Medicaid patients.
WKYT's Garrett Weimer visited one nonprofit clinic in southeastern Kentucky to see how they're working to bridge the great health divide.
Tell them to give you some limelight.
From 3 decades of practice, Dr. Bill Collins knows the need for dentists like him.
I had a girl going to a prom 3 years ago. She came in with no teeth, and she was 17 years old.
He sees it.
Yes.
Daily.
Yes.
A recent patient, just 13 years old, needing dentures.
Something's wrong.
Redbird Dental Clinic serves folks in the rural corners of Bell, Clay, and Leslie counties. It uses a sliding scale based on income, trying to close the gap that's been open wide for decades.
The need for dental care it's universal, and it's a matter of whether it's attainable or not.
Federal records show nearly half of Kentucky's Appalachian counties have a shortage of dental care for the low-income population. Part of the problem, Medicaid reimbursement fees much lower than private insurance.
It was never meant to be an entire practice. It would fill in their empty chair time, and they could give back to society in that way to help those less fortunate. And that's a good model. And if every dentist in the state did that, that would be wonderful, but many do not. And so it puts more of a burden on those that are willing to do it.
In these mountains, a long way from Louisville, but working with U of L dental students, giving them different experiences than they're used to.
At Louisville, our patients tend to be more older patients, sometimes very medically compromised patients. Sometimes here they're seeing a broad section of patients across all the age spectrums with very different dental needs and sometimes very acute needs because of the lack of care over time.
CDC data shows less than half of adults visited a dentist in the previous year in 18 Appalachian Kentucky counties. That includes all of those served by Redbird. And in those same counties, the CDC says, close to, if not more than, 1/3 of adults 65 and older have lost all their teeth.
Dentures, as a practice, it's labor intensive. It's costly, and obviously it's a part of the community here that it's a big need.
In a remote area like this, technology is helping this clinic do more with less, providing services to folks here they otherwise would not be able to get so close to home. Whitmix has set them up for digital dentures, allowing them to scan and 3D print them, making the process simpler, cheaper, and quicker.
That's exciting and near and dear to our heart to see people, walk in with an issue and walk out with a smile.
Folks at Redbird say innovations like these are critical for them to continue filling the gap here, but they can't do it alone. The nonprofit services and partnerships with private companies hoping to be a model for other underserved areas as they work to help those who need it most.
It breaks my heart when I can't find an answer to solve this problem, and I've seen it for 30 years. And it's not just me, it's every dentist out here. If we knew how to solve it, we would.
But as they deal with lower rates, rising costs, and staffing shortages, it makes that mission in these mountains even harder. In Bell County, Garrett Weimer, WKYT.
And experts say Redbird's services are critical to helping patients in southeastern Kentucky, but they're also working to try to break the cycle that makes some of those procedures necessary in the first place. We'll have more on that Monday on WKYT News at 6.